our Wednesday webinar series. My name is Chris Bruni. I'm the VP of Sales for Security Health Plan. This is a webinar series that we have started earlier this year to bring you a lot of information about what's going on within our health system. So this is a presentation that's co-sponsored by Security Health Plan and the Marshfield Clinic Health System. I am joined in that presentation with my esteemed colleague, Jeff, my co-host, or maybe I'm his co-host. I don't know. We're interchangeable. Anyway, we will be entertaining your questions today. Our presenters will go through their presentation, and we will want to do our best to answer all the questions that you have during the presentation. So use that chat feature that's up in the upper right-hand corner of your screen. There's a chat and a Q&A. We will go through those and ask those questions on your behalf during the presentation. Anything that we cannot answer because we run out of time, we will make sure we address in the formal presentation as Jen sends that out about a day after the event is over. So you'll get this presentation, all the slides, as well as any questions that we had to answer later as an addendum to that after the event is over. Should you want to review this later, it is available on the Security Health Plan website. We have a COVID-19 page. There's an employer tab within that, and under that employer tab, you'll find all of the presentations. So today's, as well as all the past presentations, feel free to peruse those at your leisure. So without further ado, to keep us on task today, I'm going to hand it over to Jeff to continue the introductions.
And for those that were on earlier, Chris held up the newest member of his family, which is a puppy. What was the name again, Chris?
His name is Rio.
Just an adorable new family member. So thanks. As Chris said, I'm Jeff Tucker. I'm the Vice President of Business Development and Care Innovation for the Marshfield Clinic Health System. Before I introduce our guests, I just wanted to point you to our website. Today is a big day for our health system. We're receiving our first shipment of vaccine for COVID-19. And all of the updates are updated in as close to real time as we can. And so towards the end of the presentation, I'm going to I'm going to copy the links into the chat box, and I'll send them to Jen so that she can include in the email that goes out as well. So you can stay up to date on what's happening. There's an FAQ to answer your questions about the flu vaccine itself. Is it safe, and everything else that you're probably wondering about. So all of that I will include in the chat box later in the presentation and in the email that goes out. So without further ado, I'll introduce the two presenters of our topic today, on-site industrial athlete services. John Ekhoff is a board-certified and licensed athletic trainer, practices with Marshfield Medical Center in Ladysmith. He began work at Rusk County Medical Center in July of 2018 and officially for Marshfield Clinic in September of 2018. He currently serves both Ladysmith and Rice Lake areas. He has over 7 years people management experience and 2 decades experience in athletic training. His areas of interest: athletic and performance enhancement, concussion recognition and management, impact trained, golf swing analysis, job function DSI training, job function matching, and injury prevention ergonomics. He's joined by Seth. Seth, is it Kuhn or Kuhn?
It's Kuhn.
Kuhn, thank you. I wanted to make sure I got it right. Thank you, sir. Seth is a Wisconsin native who began his healthcare career working in sports medicine before quickly transitioning to the occupational health setting in the Stevens Point area. There he worked for 2 years developing relationships with local employers and providing on-site services. By the end of his tenure there, he was working 40-plus contract hours a week, providing job analysis, injury prevention, and clinical therapy services. Seth began working at Marshfield Clinic in August of 2018 in an operations role, and he works closely with orthopedics and occupational health departments. In the last 2 years, he has added multiple specialty and surgical departments to his responsibilities while maintaining a working relationship with the occupational health team to help develop the industrial services program. So with that, gentlemen, I will turn this over to you.
Thanks, Jeff. We're going to talk today, obviously, about on-site industrial athlete services. And I think that the first thing we want to define is what is an industrial athlete. Simple definition, an employee who is required to perform physical tasks to complete their job. Could be as simple as your secretary, your receptionist answering your phone. Could be as complicated as the oil workers, to more of our common manufacturing jobs here locally, from food and warehouse and manufacturing. It's a full gamut. So technically we're all industrial athletes in a workplace, work setting. As an athletic trainer, we're usually the first on site. We're usually the first on scene when we're working at our high schools, colleges, and or professional athletic teams. And these are all different things that we're looking at on a daily basis. And I want to kind of draw the bridge of how does the body mechanics then relate into the industrial side? How does form, posture, lifting, safety, injury prevention obviously is our biggest focus. We want your workers to stay healthy. We want them to stay at work. We want them to stay engaged with you at their employer. It's an important piece of your health safety. It's an important piece of your culture. So we want to help enhance all of that. And then obviously with the job site analysis and what that refers to, and we're going to get a lot more detailed into all of that. Body mechanics is a huge piece of all of this, and it ties into form and posture. Golf analysis is one of my things. Golf swing is extremely complicated. That's why not many people are very good golfers. A lot of people golf, but not many people are good golfers. It's important that you have the correct mechanics, the correct form to provide whatever kind of task that you are performing, whether it's turning wrenches, whether it's answering phones, whether it's lifting, whether it's moving boxes. It's an important piece so that you can avoid that injury. So given that definition, we're going to move on here. So Occ Health at a glance, job-related injuries and illnesses make up about $250 billion. The top two expenses for employers are workers' compensation and health insurance costs. And here's the bigger piece of this that I really want you to take home today. Potentially up to 75% of healthcare costs are preventable. We're looking to help you prevent those costs. We want to help you save that money. The Occ Health benefits, obviously, we want to help decrease your mod rates and comp costs. We want to increase your employee performance and attendance. We want to help improve your workplace safety. Again, it goes back to that safety of culture. We also want to help streamline your services through that full health continuum via the system support we have through Marshfield Clinic and through Security Health Plan. One of the greatest things about first point of contact with the athletic trainers and the athletes is we can make a phone call and have them into an orthopedic surgeon probably within 24 to 48 hours of when that injury happens. Sometimes we're quicker than that, just depends. But if we can help deliver that to your workplace, we want to try to enable that as well. So our industrial therapy services overview, again, looking at this on-site injury evaluations and re-evaluations. And the important piece with this is, yep, we're here for your work-related stuff. We also want to address the stuff that's not work-related. So Jimmy twists his ankle while he's out ice fishing this weekend, and now he's going to have problems climbing in and out of his truck. That's going to affect his ability to be effective with his job. We want to make sure that we're seeing those also. That's a quick example. So we're going to do a full physical analysis of the injury, just like you would in a clinic setting. But obviously we're not going to be doing the x-ray or the MRI while we're there on site. This establishes a baseline and severity of injury and whatever limitations may exist. And then we'll obviously document how this progresses. This helps us determine if they need more care, or if there are things that we can do through early interventions and first aids to help them maintain their current work status and kind of treat themselves. These services are provided by athletic trainers primarily, and then physical and occupational therapists on a secondary basis. The job site analysis and worksite analysis is going to be one of the major focuses for us. We want to eval and assess your workstations and or jobs where there have tendencies to be specific musculoskeletal discomforts that are related to a job task. How can we make that better? How can we fix that so that your people aren't getting hurt while they're on the job? And we do that through, again, our functional job analysis, and I'm going to get more detailed on that here as we go along. A secondary source of our functional job analysis then is our post-offer employment testing. You may refer to these as pre-work screens. This gives us the ability to assess the physical abilities to perform the job that they need to do, given the functions of what they're going to ask to do. And that'll make more sense here in a couple of slides, I promise. Industrial therapy services overview. Again, we've got education pieces ready to give your employees and your employers in regards to ergonomics, nutrition, and wellness. We've got informational handouts ready on all sorts of issues, from bursitis to tendinitis to back pain to shoulder pain. We want to help you provide exercise programming to keep your employees healthy. And then obviously we've got the ability to come in when COVID allows us to come into your sites and do live presentations for your employees on various topics. While this isn't my specialty, I want to make sure that we mention the ability to provide RN services as well. And this is part of the bigger picture and bigger program. And it's an important piece. Again, respirator fit testings, providing screening exams as required by OSHA. We can do vision, respiratory, hearing, blood pressure screenings, all of that on site. Bringing in your vaccinations. With vaccinations obviously coming out with COVID, that's something that we could potentially end up doing at your workplace. So again, not my area of expertise, but I want to make sure that you're aware of that service as well. Workwell training is close to the DSI that I went through as well, that was mentioned earlier in the introduction. This is a functional job analysis system that objectively quantifies, measures, and describes the physical functional components of a job, including the required tasks, movement, forces, and postures to help develop and validate a resultant functional job description report. This is an important piece here because this stands up in a court of law. When you take this to, it's legit. It makes everything valid. Job analysis is the basis for matching workers' abilities to their job requirements. It's an important piece. Can they perform the job? So this is what a functional job analysis looks like. This job title here is a supply clerk. These are the essential functions of that job. So they have to complete disbursements and paperwork, mainly transfer product material between storage cart, pallets, lift truck, shelving racks, operate hoists, move parts in areas such as the motor room. Okay, these are the essential functions of that job. This comes down into what are these physical demands that are required. This breaks down with their lifting, their pushing and pulling, pinching, gripping, etc. So you have a very handy piece of paper that you can hand to your potential employees to say, can you perform these tasks? And this gives you your frequency key as far as how much of my workday is spent doing these specific activities. Followed up by that, then we get into our post-offer employment testing. And again, this is a sample sheet for you to look at. Again, this is a different job. We're looking at a buildings trade job. Over here, you have all of the job tasks that are being required to perform. This is the test that we would then do with that employee to make sure that they can pass and handle, okay? Our test score sheet over here looks like this. So they're going to need to lift, carry, push, pull this test. Here's your passing score. This determines whether or not they passed their pre-work screen or not. So again, I wanted you to see these examples, and this is something that we can provide to you as the company when we do the functional job analysis. This is an example that I wanted to share with you. I want you to see how this works. This is an example of a company that we're currently involved with. They have 275 employees. They're in food manufacturing. We ran reports in 2009 looking at specific injuries that we treated while these people were injured on the job. We calculated costs. We were able to keep these people out of bigger care. And because we were able to do that, again, we're not taking them out of care. We're not saying they can't go and get more care. That's not what we're there for. But we were able to help them get through that specific injury. This company was able to avoid almost $250,000 in cost. That's a big chunk of change. So I talked super fast to cover through everything in the time allotment that we had. These are the contacts, myself, Seth, Chad, and then this is our business health solutions people. If this is something that piques your interest, if this is something that you want to bring on site, this is how you can get a hold of us to ask more questions so that we can come out and have more in-depth conversations as far as how this may work for you and your company. Questions?
All right, jumping back on, I do have a question that did come up actually before the presentation even started. So employers are trying to avoid any claims that are recorded for them from an occupational health perspective.
Correct.
How does working with your program and that employer, how do they work with you guys to make sure they can avoid those that really should be avoided off with their reports?
Us being able to provide that first point of contact is the critical piece in that, meaning when an injury happens, we're the ones that are going to see them first, and we can help answer a lot of those initial questions that employee is going to have in terms of, do I need to go in? Do I need further testing? Do I need an x-ray? All of that. And looking at my past experience with the employers that I've been at and the employees that I've been involved with, they come in and my shoulder's out of place. Well, okay, is it really out of place? And do you really need to go? Let's do some testing. Let's see where things are at. I threw out my back. What can I do? My knee's all busted up. I can't do this. Give us an opportunity to work with them in the initial get-go, and we can help guide a lot of how that is going to play out.
Yeah, and just to kind of piggyback off of that and add to it, that's definitely the way we directly influence potential work comp claims and costs. The indirect way, again, goes back to our functional job analysis and that focus on safety and avoidance of putting people in unnecessary, unsafe situations. So fully testing the employee before they're coming in, but also walking around the facility and analyzing the job. Most companies, they have their safety folks, their safety leads, but we can add to that program and add some objectivity to some of those measures as well, so we can become a part of that safety team as a whole.
So how is this different than maybe the approach we would have taken, I don't know, 3, 4, 5 years ago before the advent of this kind of thought process?
Go ahead, Seth.
I mean, what used to happen with most companies, and does still happen with a lot of companies today, is that an injury would happen, the supervisor at the plant or at the site would have to report that through their safety committees, and they'd immediately just refer a patient over to the urgent care. And then the patient just becomes a part of the system, which doesn't typically aid in the avoidance of work comp costs. It will generate more recordables than it saves, because urgent care isn't a specialty clinic, so they're not going to get a good musculoskeletal evaluation, which is the majority of all these on-site injuries. So yeah, the old school method is just send them right into the system right away. New school method is bring somebody out who has a knowledge base in the workforce in the industrial setting and has a good musculoskeletal background, to help screen these employees and guide them all through the process and guide the company through the process to not only make improvements at the work site in safety, but also improvements in employees' perception of injuries and self-care to avoid these injuries, the furtherance of work comp issues down the road.
Have you guys found some consistency then among the employers that you're working with, where you've taken the proactive approach? Because again, with workers' comp, the employer can't get into a network. They can't tell the employees where they have to go. But have you found that by building that taking that first step and being a little more proactive, you're finding consistency among that employer, that they're getting the results that they should see? Because more and more of their employees, when they actually do have an injury, are coming in and following through on your process.
Yeah,
I think that,
there's a big buy. Sorry, Seth. There's a big buy-in. There's a big buy-in when you put a system like this in place, and the employees are more than happy to come in and tell you life stories in regards to, not just non-work and work-related injuries, but it works. My past experience, I've seen companies reduce their OSHA recordables 40 to 60% in that first year, potentially 2 years, with bringing something like this on.
Right. Just adding to that, it's and John kind of touched on it. It's really about the relationship building, having somebody on site. You got to work to gain a little trust with employees. But once you do that, and if the company at the same time that we're there putting in the time and building the relationship with the employees, if the company leadership at the same time is showing that buy-in as well, and showing that we care about you guys and we care about this program, and buying into the program at the same time, it really creates a cultural shift on the perception of workplace injuries and being willing to work with us. Because I know in my past experience, when I started working with a company that really hadn't done it before, they were concerned about, is the company now getting my health information? And it takes being there and talking with people and displaying that buy-in from the leadership and our conversations combined to really show what the reality of our service is to the employees.
You had mentioned, thank you. Sorry. You had mentioned that 75% of healthcare costs are preventable. In your experience, does that require, is it just a change of workflows? Is there a significant investment in redesign of processes and equipment or furnishings or work-related? I guess furnishings is the best word I can come up with. Or is it truly workflow and training?
My perception on that is the majority of it isn't really workflows and different equipment. Sometimes it can be, and that's why a lot of places have Worksite Engines that can help. Actually, that helps us aid in the discussion with that. We can get involved with the engineers if there's something that should change or a process that should change, because those obviously can be costly or they can be pretty simple. But we're there to start that conversation. But I would say from my experience, for the most part, It's more so employee driven. Their ability to do a particularly difficult task, should it be them doing it by themselves? Should they really be in that position? Or is it simply a body mechanics thing? There are certain positions the body is simply not meant to be put in for chronic periods of time because it will develop injuries. So being able to be there and spot those things and educate employees, especially before they even get to the job site via pre-work screen, can help aid in decreasing some of those injuries.
Makes sense.
John, can I have you scroll through to the POET report again?
The POET report?
Yes, please.
Here you go.
I just wanted to have this displayed again because I think this is a tremendous report that you can give back to that employer about what you're finding there. And I don't know if you wanted to add anything more to that, but there's a lot of detail on this.
There's a huge amount of detail. A huge amount. Yeah.
Yes, this is just a sample, right? But for
Right.
any employer, this is going to look a little bit different, depending on what that employer's task lists are. But yeah, I would think this would be a huge resource for any employer that wants to kind of get at the crux of why maybe they're seeing a recurring injury happening.
Yep. And it's, you know, we haven't really touched on it yet in this presentation, but a lot of us are dealing with an aging workforce also. You know, should they be going through these testings annually, you know, just to make sure that their workforce is safe? Part of that functional job analysis also is to make sure that you're going through and looking at those jobs every 2 years to see if they're truly valid, you know, how much has changed within that job also, you know, and how does that change the testing? How does that change the job tasks that are associated with it? You know, those jobs don't stay stagnant for years on end.
Mm-hmm. I'm curious now that we have so many people working from home, and I know that doesn't really affect necessarily the industrial employees. They are still working in their facilities, but we do have a lot of office people working from home. I'm wondering if we're going to see a change in some of these injuries as they come out because people are doing things at home and maybe doing tasks that are more work related at home that they wouldn't have done before that are going to cause them an injury. Thoughts on that?
I would agree with that.
I'll be curious to see what happens because you're not necessarily stationed in your desk at home like you would be at work.
Mm-hmm.
How many more distractions are you going to have at home than you would at work? Are you going to be in that position less frequently than you would at work? I know I am. When I'm working at home, I'm constantly moving. When I'm here in the office, I'm kind of stuck. So is that going to help reduce the amount of injuries that we potentially see down the road also?
Mm-hmm.
Seth, your thoughts?
I would tend to agree with that. In the office setting, if you work more of an office position, you're not running around as much as you would if you're doing it from home. Like you said, more distractions, more ability to walk and pace while you're on the phone, something like that. Well, versus in the office when you're sitting at the desk at a computer, staring at a screen all day, displaying more opportunity for poor posture. But yeah, I'd be interested to see over time what happens with that if more jobs do transition to working more from home. But I still think we'll see some of those chronic issues, but maybe we'll see a decrease.
Okay. Well, we're pushing up against the clock, Jeff, unless we have other questions or comments.
No, I'm going to post the links that I promised at the beginning of the webinar. And I think that should pop up in everyone's chat. Jen,
Yep.
Can you tell me if that popped up? Or
It did. It just did. Yeah.
Okay.
Yeah. So that's out there in the
I'll
chat.
be sure to include that in the email as well. But there are some links on the latest updates on COVID-19 flu vaccine, and FAQs.
All right, and I know, John, you do golf swing analysis, and Jeff had promised me that you would do mine, but then I understand there's a paper shortage, so that the report would be too lengthy to get me that analysis. So unfortunately, that'll have to wait till a different time. But,
I don't know if they do that for miniature golf, Chris.
Anyway, thank you, all of you, for the presentation today. Great information. Really excited about the program. And if any of you are interested, we do have the link in there. You can call the sales line for Business Health Solutions, or reach out to your account manager at Security Health Plan. They can help you with that as well. We've got a full team of staff that can help you get in touch with our resources here at the clinic related to the Industrial Athlete Program or any of the other occupational health services that we're providing out there. So, gentlemen, once again, thank you very much for your time today. Great information. Look forward to hearing more from you in this program as we continue to roll it out to more and more employers.
Thanks for having us.
You bet. Be well, everybody, and happy holidays.
Thank you. Bye, everyone.
Bye.